Hello, Bethany. Welcome to the podcast.
Hi, Claire. Thanks for having me.
Thank you so much for coming on. So, Bethany is a physiotherapist specializing in pelvic floor and women's health, and you are also a pregnancy and postnatal yoga instructor. So, obviously, I've skimmed that introduction. Tell us a little bit more about what it is you do.
Sure. So, I'm primarily a physiotherapist, Claire, and over the years, I've done lots of extra training in women's health, pelvic floor dysfunction, pregnancy, postnatal. So essentially all issues affecting women throughout their life stages. And my real passion area is working with women with pelvic floor and pelvic health problems. And I also teach yoga. So yeah, pregnancy yoga, postnatal mum and baby yoga. So it's a really nice marriage of those two areas, and they work so well and support one another.
They do. Yeah, that is perfect combination of things.
Good combination. Yeah.
So helpful for people, and so important that people pay attention to these things as well. We were saying just before we started recording, but so many people don't pay it the attention, particularly I think pelvic floor and pelvic health and things like that. So it's 100%. So important to pay attention. You don't really realise it, I think, until you've actually had a baby, how important that area is for to keep it healthy.
Definitely.
So talk to me a bit about pelvic floor. Sure. Why is it so important, and what are the ways that we can kind of make sure that that muscle is doing its best?
Yeah, for sure. So I think the pelvic floor is one of those areas that a lot of people don't know a great deal about. It's often a bit mysterious, but essentially the pelvic floor muscles, really important group of muscles for women to know about through their life stages, especially during pregnancy and in that postnatal phase. So in terms of where are the pelvic floor muscles, just a little pelvic floor 101. So essentially your pelvic floor spans from your pubic bone at the front of your pelvis, like a sling underneath you back to your tailbone, and then out to either side to your sit bone. So essentially it's like a bowl supporting your pelvic organs underneath you. The pelvic floor has a really important function in your continence, so keeping you clean and dry, and has a hugely important role during pregnancy and obviously in childbirth. So the pelvic floor muscles, we want to make sure that they are strong, so they have really good strength, but also that the pelvic floor muscles can relax. And that's really important in pregnancy leading up to labor and birth. Yeah. So some things we can do with regards to pelvic health and making sure your pelvic floor is functioning really well for you, particularly in pregnancy, is definitely by knowing how to find your pelvic floor muscles, how to activate them, doing some pelvic floor exercises, or otherwise known as Kegels, but also making sure there's some balance in that. So you don't want to just do heaps and heaps of pelvic floor exercises. Great, you'd be working on strength, but we also want to make sure that the pelvic floor muscles have their full range and extensibility, and that those muscles can relax. And also that we know what relaxation in the pelvic floor muscles feels like going into labor and birth. And that can be really, really helpful and beneficial.
Because they need to relax, I'm guessing, for the actual kind of pushing the baby out stage, although I don't 100%. Like the word pushing, but you know what I mean? The breathing the baby out stage. They need to be relaxed for that, don't they? So yeah, it's important that people, and also I talk about on a course, like I tell people that how important it is to do pelvic floor exercises. And it can prevent tearing or help to prevent tearing, things like that as well during labor. But they are boring, and I think so many people feel that. I do as well.
Yeah.
I remember when I was pregnant, one time every day to do these really boring, and they kind of almost freak me out a little bit, like, the feeling of it. Like, I don't like it. But they are important, and doing it every single day is so important, and you will definitely benefit from it when it comes to labour. So they can help prevent tearing. What kind of, I know on your website, I was having a look at your blogs and you were talking about perineal massage and things like that.
Yeah, absolutely.
It's all, can you explain a bit about perineal massage and how that links to the floor?
Absolutely. So what I like to, when I talk about the pelvic floor, in terms of birth preparation. And I think this is a really growing, emerging area that women want to know more about. And I'm really a passionate advocate for birth preparation. There's so much as a woman you can do in pregnancy to prepare your body for labour and birth, and particularly your pelvic floor. And I think also this gives women a bit more of a sense of control over the situation. It's not just hope for the best. It's actually, I've prepared myself as well as I could have possibly done. And, you know, to agree, we all know labour and birth can be unpredictable, but by doing some preparation for your pelvic floor, it's such a great idea. So your pelvic floor is perfectly designed for the job at hand and to relax and lengthen in order for you to birth your baby. So your pelvic floor muscles are able to stretch up to 2.5 times their resting length.
Wow.
So I was just like, pause, like, that is incredible. Like, there is no other group of muscles in your body that is able to stretch that much. So there's 250% that they can increase in length. It's amazing.
So I think this about, like, when I talk to people about what our body actually does in labour, like, when you actually know all of the amazing things your body does, how your body changes to facilitate labour, like, of course we are designed to give birth, like, that's kind of, we know that, but it really does make it sink in that we are, every part of us is so perfectly designed to be able to allow a baby out, basically. And that's
absolutely, absolutely. So these muscles have amazing stretch and extensibility. And so in terms of birth preparation and perineal massage, I talk about perineal massage with internal release work as well. So we're not just thinking about that perineum, which is the perineal body, that piece of skin between the vagina and anus. Yes, that is important to do some massage to that area. But also I'm talking to women about some internal release work. So that's helping to stretch and release the pelvic floor muscles so that when it comes to labour, you're able to recognise and identify that sensation of stretch in your pelvic floor. So if you've had a baby, then you'll know when I talk about that sensation when your baby's head is on your pelvic floor, you'll be thinking, oh yeah, I'm aware of that sensation. So what we're just trying to do with perineal massage and internal release work is enable you to identify what stretch feels like in your pelvic floor and to not be frightened of it, but to be like, okay, that's what stretch feels like. So that when you experience that stretch, when you're giving birth, it's not something to be frightened of. It's not something to tighten away from. It's something that you are able to release into and surrender to that sensation. And I think that can be so helpful and really transformative for women to be able to identify.
I say it to people as well that perineal massage, like you said, it has that benefit of obviously stretching and, you know, helping that area become more elastic, but also it gets you used to the feeling so that when you are in labour, it isn't this like, what is happening feeling. And like you said, you're like to kind of clench if you feel that, because when we feel like scared of anything, obviously we
absolutely.
So it's very important to, you know, that area doesn't usually stretch in that way, so it's important to get used to that sensation before, so that
100%. And there's actually, you know, there wasn't for a while, there was, you know, not amazing evidence for perineal massage, but more latterly, there's been some newer evidence looking into perineal massage and its benefits. And actually, there is some reasonable evidence now that we can say to women, hey, you know, there is some evidence to suggest that actually by doing some perineal massage, it can reduce your risk of significant tearing, reduce your risk of needing a episiotomy, and help you to recover faster post-birth. So some really good reasons for giving it a try. Obviously, I always counter that just to say to make sure you get some clearance from your midwife or your obstetrician to make sure that they're happy for you to do that perineal massage in your 3rd trimester, and it's normally from around 35 weeks of pregnancy.
And how often a week would you recommend someone doing that perineal massage, and for kind of roughly how long?
I would normally say if you can do it sort of between 5 and 7 days a week. So I'd say if you can do it every day and make it your routine. If you're doing it 3 times a week, good. If you're doing it 5 to 7, great, even better. And I'd say just spend sort of 3 to 5 minutes doing that perineal massage. And there's some links on, and I'll talk to you at the end on my website. There's some resources there and some links to some little infographics about perineal massage that women might find useful.
People are quite scared of it, I think, but it's maybe worth a go. Like, even if you don't love it. Like, you know, if you out or whatever.
Yeah, you'd probably rather be doing something else with your time. But
but it's good to know, because you never know. And I know a lot of people do it now and do get on okay with it. And it's just one of those things, isn't it, that if you kind of don't mind taking the time to do it, you kind of almost might as well, because it could benefit. Obviously always good. So how can you help? So obviously, say this is the preparation for labour. I'm guessing you see a lot of people after their labour who have had kind of some sort of trauma or are suffering with bladder issues and things like that. Can it be fixed, basically, if you have any kind of damage there to pelvic floor? Is it able to be fixed?
Absolutely. Obviously depends on the degree to what that is, or the type of injury or complication that you might have sustained. But I offer something called a new mum checkup appointment, and I really encourage women post birth to see a pelvic health physiotherapist. I know in the UK that's something the NHS does offer, or privately you can seek out a pelvic health physiotherapist just to see somebody for an evaluation of your pelvic floor post birth. I'd say, you know, no matter what, if you've had a vaginal delivery, if you've had a C-section, either way, it's still a really great idea to see somebody, have an evaluation of your pelvic floor, just to know where you're at. So you could have an evaluation to look at how strong your pelvic floor muscles are, look at their function, discuss any kind of problems you might be experiencing, if you have had any trauma to the area, if you have any scar tissue, if you're having any problems with your continence. And to get that advice and information and a rehabilitation program really early on is really, I think, really beneficial. So I'd say any time from about 6 weeks postnatal is a great time to seek that out. So yes, absolutely, there's a lot of things you can do. Pelvic floor muscle training can be extremely beneficial and helpful if women are having any kind of incontinence, urinary incontinence. Yes, so in short answer, yes, there's a lot you can do to help with recovery post-birth.
I think that's really useful, because probably a lot of people don't realise that that kind of service is available.
It is, yeah.
They maybe just have to suffer in silence if there's any kind of damage, or maybe they might not even be aware that there's damage, like you say. For sure. It's good
And I'd say, even if you're not symptomatic, you know, if you've had, particularly if you've had a baby vaginally, then it's a great idea to get that pelvic floor profile to say, you know what, actually those muscles are doing really well, keep doing what you're doing. Or we might say, you know what, in these areas they need some work, so do X, Y, and Z, and, you know, do this type of pelvic floor exercises. And yeah, so it's a great idea, even if you're not symptomatic. If you are symptomatic and have any type of pelvic floor dysfunction, and by that I would mean if you're having any kind of incontinence, if you have any sort of heaviness or dragging, or feeling of pressure or lump or bulge in your vagina, any symptoms to you that just don't feel right, pain with sexual intercourse, all of those types of conditions, all a reason to see somebody and have an evaluation. And there's absolutely a lot of things you can do to feel a lot better.
And so you said about cesarean as well. I'm guessing it's affected by that as well, because you are still carrying a heavy baby.
Yeah, you've still... Totally. So you've still been through pregnancy, you've had all those hormonal changes. So definitely still a really valid reason. And then if having had a C-section, there's things we can look at, thinking about your C-section scar, looking at extensibility of the scar tissue, thinking about abdominal rehabilitation and recovery of those deep abdominal muscles. And also if women might be experiencing any kind of abdominal separation post-birth.
About that separation. I mean, that might come into more talking to you in terms of yoga, does it? Or like the exercises you can do to help that?
Yeah, a little bit. I would say, you know, we can definitely talk about that now if you like. So it's something that I always offer routinely for all women post-birth, just to evaluate that muscle separation. So to have a separation of your abdominal muscles in pregnancy is a totally normal part of your pregnancy. So your growing baby needs some extra space in your tummy. And again, your body, amazingly designed, so clever, that those abdominal muscles just separate, grow naturally to accommodate your growing baby in the tummy. So for most women, those muscles will find themselves back to a resting position quite happily. But for other women, there can be more of a degree of separation, and that sometimes can be slower to recover or come back together postnatally, and sometimes there can be a bit of thinning of the connective tissue between those two muscles. So yeah, that's something I always offer to women. It's really normal to have a small gap postnatally, and for some women they will always have a small gap, but it shouldn't necessarily impact you day to day. You should be able to resume all your normal exercise and fitness goals, and it shouldn't hold you back in any way. But yeah, that is definitely something that I would look at, and it's really about trying to build those foundations of the core strength from the inside out. So a real graded approach to rehabilitation and to core work, as opposed to kind of diving in the deep end straight into your really high level. Sorry, say that again.
Very gradual.
Totally.
First, isn't it? Like nothing.
It is.
No sit-ups.
It's a gradual process. Yeah, so it's avoiding anything like, you know, sit-ups or full planks initially. We definitely need to load the abdomen, so it's really important to load the muscles. So we don't want to go too cautious, too gentle, but it's real specific to each woman depending on her symptoms, her fitness levels. But we definitely need to apply load, but it just needs to be essentially graduated in a progressive manner. Yeah.
Does it depend on how many children you have? Like, you know, if you have 3 children, is it more likely to separate?
You might have more of a degree of separation, and with each pregnancy, you will likely to have that separation. It will depend on different factors, how much fluid you're carrying, the size of your baby. So there's lots of factors, but essentially, yes, to a degree, the more children you have had, there can be more of a degree of separation because you've had more extensibility and more closure.
I guess that makes sense. I definitely remember I don't remember noticing anything after I had my first, but my second, I do remember kind of laying down and feeling that muscle, and definitely feeling a kind of like finger size, sort of, you know, fingertip size gap along that muscle. And I think I probably did Google like exercises to do. I remember doing some. I haven't actually felt it for a while, so I wonder if it's close.
Good news. So essentially anything less than about a 3 centimetre gap is considered within normal postnatally. So yeah, so really normal to have that. It's just as well if you have any symptoms, if you have any kind of pain or dysfunction, sometimes that can cause some issues with the low back as well, if you're lacking in some control and strength through those abdominal muscles at the front, especially being a new mum, humping and dumping babies, capsules, toddlers around, like it's hard out on your back. So if your abdominal strength is compromised, you can definitely feel the effects of that in your back as well.
Yeah.
Other things you might notice with an abdominal separation, you might notice a coning or a doming shape on your tummy. Sometimes it can be the opposite, and you might notice like a hollowing between those two abdominal muscles. So it can present in both of those two ways. So if those are signs you notice, then again, getting checked out by a physiotherapist, great idea.
Yeah, oh God, yes, it is a good idea. I just don't think that people so often just think, well, that's part of, you know, having a baby, what comes with it. But it doesn't have to be that way. We can prepare ourselves afterwards, definitely. What other ways can we prepare our bodies for labour?
Yeah, so we've talked about already perineal massage and release of those pelvic floor muscles. I often in my pregnancy yoga classes, we take an approach of looking at lots of really nice mobility exercises for the spine, for the pelvis in particular. Exercises designed to work out any kind of muscle imbalances during pregnancy, enabling you to have a really lovely range of motion through your spine into your hips, postures to help with that opening through the pelvis and into the pelvic floor, and also doing some gentle strengthening work, so keeping strong and keeping fit through pregnancy. You know, we all know sometimes labour can be a bit of an endurance event, so making sure we're strong and well prepared, particularly in the lower limbs, so thinking about the legs and the hips and the pelvis, making sure you've got some good strength there as well to be able to maintain different positions and to be comfortable through labour. If you can be as active and upright as possible for as long as possible, we know that that has often a really good positive effect on your labour, on the length of your labour, how effortful your labour might be. So yeah, training in all of those different areas can be hugely beneficial.
Yeah, being active and kind of you know, moving around and things like that. And also it's so important to prepare our body. I talk, you know, obviously what I do in hypnobirthing is I prepare the mind. The mind is so important to how our body behaves. So it's really important to prepare the mind, but also the body. We can't neglect that. We need to, obviously the body is going to kind of behave how your mind sort of influences you, but it might, you know, if it's in the best possible shape for, and I don't mean like physically, like fitness, I just mean the floor, like if all of those things are in the best shape, then it's only gonna ever benefit your labour.
Definitely. And I think also, you know, some light exercise through pregnancy has a really great effect for mental health as well. So all those positive benefits, you know, and as you've said, Claire, like preparing the mind is so important. And I think, you know, pregnancy can be a time of a lot of worry and anxiety for some women. And so having the opportunity to do some light exercise, a bit of mindfulness, some relaxation, those things are things that I do within my pregnancy yoga classes, all of them. They're so important. Some breathing exercises for relaxation and mindfulness, just really simple things that women can apply to their daily life and actually just have that time in their week for themselves to spend some time with their baby. To, you know, and to have that opportunity is so important because life is busy and, you know, your mind is constantly going with to-do lists, and then you have those worries and anxieties trucking around as well. So to have an opportunity just to take a pause from all of that is so important.
I say that as well because part of what I teach is the relaxations that you kind of, you know, ideally practice every day. They're only like 10 minutes at night, but you know, I kind of try to sell it to people like you rarely get time. We rarely put aside like 10 minutes a day to just relax. So it's actually really lovely, like you said as well, to just take that time and to relax and connect with your baby and connect with your partner. And it's just a lovely excuse to be able to do that every single day. It's termed as practice in hypnobirthing. So, you know, that is the kind of practice I like. That is basically just relaxation and relaxing yourself. We might have already covered a little bit of this already, but as you said, you're a pregnancy and postnatal yoga instructor as well. What are the benefits of doing yoga prenatally and then obviously postnatally as well?
Yeah, so you're right, Claire, we have touched on it a little bit, but I think from a pregnancy prenatal perspective, having that time out in your week for some relaxation, for some gentle exercise, hugely beneficial. A lot of the postures are focused on mobility for your body, for your pelvis. Also, I do a lot of work in my pregnancy yoga classes for optimal fetal positioning as well for women. So giving them lots of information and advice on really great positions they can get into during their pregnancy, particularly into that third trimester, that are going to be really beneficial for getting your baby in the best possible position for you to enter into labor and birth. So these are postures that we practice a lot in yoga and then practice at home. So I really encourage women to kind of take that with them into their daily life, as well as all of their pelvic floor exercises and preparation work. So I think, you know, those are some of the really great benefits. Another thing is just for mums to get to, you know, mums to be to connect with other mums to be, like, is a really lovely thing. So you're all in that same position. We do some introductions and, you know, people can form some connections in the local area, and that's the beauty of having in-person classes, which are amazing to do.
I'm kind of slowly coming back over here anyway, I think, in-person classes.
Slowly coming back. Yeah, we've been very lucky in New Zealand that we've been able to kind of keep going with the in-person face-to-face classes, but, you know, that's a huge benefit of, you know, being able to come into that class setting, definitely.
Can you start prenatal yoga from any time, like pretty much from straight away?
I recommend starting from into your start of your second trimester, so from 14 weeks, just to ensure that your pregnancy is established. And probably by that time you've seen a midwife or a doctor, and you've got a little bit more information with regards to if your pregnancy is low risk, or if there's any kind of medical issues that your teacher would need to be aware of, or any kind of precautions or contraindications to exercise. So that's my recommendation, but people will do different things. The majority of classes like that tend to be from your second trimester. If you've already have an established yoga practice and you're going to an open class, not a problem. But if you're starting something new,
I think that is always good advice. If you're going to start anything new, then yeah, like nothing too vigorous probably if you're going to start it new in pregnancy, but yeah, for yoga, so that makes sense. What about postnatally? How can it benefit postnatally?
So postnatally, the way I run my sessions it's postnatal recovery session with babies. So it's mum and baby yoga, but so mums can bring babies and we definitely incorporate babies into the session. But the session really is about recovery for mum. And I recommend people attend from 6 weeks postnatally if they've had a vaginal delivery, or 8 weeks if it's a C-section birth. And we will look then at lots of pelvic floor recovery. So a real nice, gradual, steady progression through the term. And I work within like a 10-week term, which is amazing. So we have lots of time with mums to build strength gradually. Lots of advice in there about returning to exercise safely. We talk lots about pelvic floor dysfunction, abdominal separation, things to look out for. And it's a real graded approach to pelvic floor, to abdominal recovery as well. Thrown in the mix, lots of nice relaxing yoga postures that incorporate baby and some gentle strength and toning work.
I love that. I know some of my listeners, I do have listeners in New Zealand because they're everywhere, which is amazing. But I know so many of them are going to be like, I want to go to her class. I'm halfway across the world. But I'm sure there will be others. There will be others nearby.
Absolutely. There's lots in your local area. And my plan is over the next couple of months, Claire, I'm going to hopefully get my classes online. So not quite the same as in person, but just so people can access them from anywhere. And especially, you know I have mums that have got other kids, and sometimes getting to that class time is a challenge. So my aim over the next couple of months, I watch this space, is to get my classes online. So they'll be available anywhere for everyone if you're interested.
We've become so online in the last 18 months. I think a lot of people just feel so comfortable with doing things online now. I did a kind of a group of online Pilates classes like not that long ago, and it didn't feel like, I mean, obviously it is different from being there in person, but in a way it was quite nice. Like I could leave it to like a couple of minutes before to get my mat out, and
right, I'm here. Go.
Yeah, like it's quite easy, like doing it at home, just kind of turn up 5 minutes before. It's really easy. So when I said to my lovely Instagram followers that you were coming on, did they have any specific yoga questions, pre or postnatally? I had a few questions for you. So if you don't,
go for it.
I've got away with me to ask you. Okay, so the first one was somebody who has got scoliosis, and she has rods either side of her spine and is pregnant. Is she able to do yoga with that? Is there anything kind of specific that you would recommend for her?
So I would absolutely hope that she could do yoga and take part. My advice would probably be for her, if she was seeing me and wanting to come to my classes, I would say come and see me for a one-to-one session. So prior to that term starting, and I'd encourage her to do the same if it's a local class she's looking to go to, or even just to touch base and perhaps see a pelvic health physiotherapist. And that would be so that I could evaluate her presentation. We could talk about her scoliosis and the surgery that she's had, and then any limitations that she might have. We could look at her range of movement through the spine. But I would always hope that there were some modifications that we could use for her in class, so that she could come along and for it to be inclusive, because so many benefits. And I think as well, sometimes people think, when I get inquiries, people say, oh, I've never done yoga before, I'm really inflexible, can I still come? And I'm like, absolutely, like it does not matter. It's not about flexibility. No. It's not about being able to bend over and touch your toes. Like it's not the aim to be, master yogi, super flexible. Like that's really not the point. It's a really, particularly in pregnancy, yoga for pregnancy is gentle, tailored to everyone, and there should be appropriate modifications that you can make for the vast majority of people. Always a good idea as well to touch base with her midwife or obstetrician to check that they're happy for her to take part in gentle exercise and yoga for pregnancy.
So it's not out of the question. She can definitely explore.
Definitely explore that. Yeah, absolutely.
Okay, somebody else has asked, how does yoga help your body prepare for birth and post-birth recovery? But we have answered that one, I think.
Yeah, I think so.
Yeah, we've answered that one. Okay, how can you strengthen your core muscles after the baby is born? Are there any easy yoga moves?
So I would always say it's really progressive. It depends on what your level of fitness was like before you had your baby, and what you did during your pregnancy. So those things are all going to be important. Exercises, I would say, as a general rule of thumb, to focus on that deep core connection with your pelvic floor and your breath. First and foremost, really important. So find that connection with your breathing, pelvic floor and deep abdominal muscles, and then a progressive program, generally starting off with exercises in a neutral spine position. So that would mean either exercises laying on your back with your knees bent, 4-point kneeling, side lying. So essentially, in the early days, you're avoiding exercises that might create excessive pressure around that area. So like a full sit-up position or a full plank position are things to generally avoid in those early postnatal days. But again, seeing a healthcare professional, physiotherapist, personal trainer with special training in women's health, pregnancy and postnatal, great idea, just to get some bespoke, tailored exercise. Yeah. Cool.
I've had a couple of people ask me a similar question about squatting, and I'm not sure if this is because this has been shared recently. I've seen it, I shared it, and I've seen it on a few other accounts as well on Instagram about the deep kind of squatting that you see people doing, how it can be avoided during pregnancy. Why is that bad? Why should it be avoided? And can we still squat, but maybe not like a deep squat?
Yeah. Well, the way I look at this is everything in moderation. So squatting is a really functional position. So we squat every day. You know, if you have small children, you are going to be squatting. If you're pregnant and you have a toddler, you're going to be bending down, squatting quite a lot during the day because you have to.
And when you're bending down, you can't bend from the waist, so you kind of have to squat, don't you?
You squat. Exactly. So squatting is a functional position. So I would never say to someone, don't squat, avoid all squatting. I think in moderation, you know, if you're squatting as part of an exercise program that has a variety of other different exercises, and it's safe for you to be exercising and you haven't had any specific precautions from your midwife or your doctor to say don't squat, there are some certain conditions that might make squatting uncomfortable, that deep squat position. So if you have any problems like hemorrhoids or vaginal varicosities or significant pelvic organ prolapse and in a deep squat position, that exacerbates those symptoms, then those would be reasons to not do that. Or if you have any other complications with your pregnancy, again, that you've been told to avoid. But otherwise, you know, squatting can be a really amazing preparation for birth and for labour as well. Some women will birth in a squat position. So it is really functional. I think where it comes from, the don't deep squat, is related to if your baby is in a suboptimal position for birth, so possibly if your baby is in breech presentation or in an OP, occiput posterior position, and you're doing a lot of deep squatting, the thought is that there's a risk that you may how to describe it, you may encourage your baby to engage in that suboptimal position, and we want to give your baby lots of room to move and rotate and spin in order to find themselves in a more optimal position for labour and birth. But you know, from my perspective, I think you'd have to spend a lot of time in a squat position for that, you know, to really be impacting it. So I would say in moderation, squatting is great for maintaining lower limb strength, great for pelvic extensibility and flexibility. So long as it's in moderation, it shouldn't hopefully cause you any problems. But yeah, I've seen it bouncing around a lot on social media at the moment. Having them from a lot.
Yeah. Okay, I've got one last question. And this is actually coming from a friend of mine who is a yoga instructor as well. But she just basically wanted to know about your pre and postnatal training, and I guess this could be interesting for other people as well. And she's asking this because she is interested at some point in her kind of career in training. Was that done kind of on top of your just general yoga teacher training? Was it part of it?
No, it was a separate course. So I did my 200-hour yoga training, and then my 300-hour to make up to a 500 registered yoga teacher training course. And then I did an additional pregnancy yoga training, which was amazing, just to take on all those other considerations. Lots of really lovely training in suitable postures, things to do, not to do in pregnancy. And then a lot of the work postnatally I do comes from the pelvic health physiotherapy training that I have as well. So yeah, I use a lot of those skills all through. But yeah, it is an additional training course, which I'd really encourage anybody that's interested who teaches yoga. Gives you lots of great information about anatomy, physiology, labour and birth physiology, and considerations for the pregnant and postnatal woman.
Yeah, I guess it's very, you've got to be quite specialised, not to use that word. You've got to be quite specialised in it, I suppose, because it is dealing with pregnant people or people who have just had children. So of course, like
absolutely
involve its own set of kind of things that you can and can't do. Well, thank you so much. I really feel like we have covered a lot about pelvic health and women's health and yoga and things that people can do to stay fit and healthy for in preparation for their baby to arrive. So thank you so much. Where can people find you? So follow everything you're on. Where are you?
Thank you. So I'm currently in Wellington, New Zealand. So my physical classes, I'm in the Hutt Valley, close to Wellington. And in terms of my online presence, you can follow me on Bethany Ford Physiotherapy and Yoga on Facebook and Instagram. And as I said earlier in the podcast, Claire, my classes hopefully in the next couple of months are going to be online, so you can access them anywhere, which is exciting. On my blog, on my website, which is bethanyford.com/blog, there's some posts in there about preparation for birth, about pelvic floor recovery, lots of real areas I think hopefully your listeners might find interesting. There's also a resource list of some real great evidence-based resources for pregnancy and birth as well that they might find interesting.
I had a quick look on your blog and there was some really interesting blog posts. So I definitely recommend having a read.
Thank you.
I always say, and I'm sure everybody does, but information is, knowledge is power.
Totally. Knowledge is power. Yeah. Be informed for sure.
You can. And you're just going to be yourself in such a good position to have a positive birth experience. Like you said, birth is unpredictable. We don't actually know what's going to happen, but the best we can do for ourselves is prepare mentally and physically, and that will give us the best shot at having a positive birth experience. So thank you for sharing your knowledge and your wisdom and your experience. It's been really interesting.
My pleasure.
I reckon people are going to find it very interesting. So thank you.
It's my pleasure, Claire. Thank you for having me. I appreciate it.
Thank you. Bye.
Thanks, Claire. Bye.